Okay, well, it's 6:35, and I think we'll hop into this evening's session. So thank you for those who have joined us, and welcome to this evening's family education session. My name's Joanne Jones, and I am the Senior Director for Kinark's Children and Youth Mental Health Services. And I'm happy to be here this evening to welcome you to our family education session. This evening's topic is Newcomers to Canada, Mental Health Information for Caregivers of Children with Disabilities. Our family education series was developed in partnership with our Family Advisory Committee, is intended to build on your capacity as caregivers to identify, understand, and respond to childhood and adolescent mental health distress. During tonight's session, you will learn about research-based information regarding mental health challenges that can be faced by newcomers to Canada, information about parenting a child with a disability, i.e. autism, in combination with newcomers' experiences. We'll discuss and look at the challenges of assimilating to a new environment. There are a few housekeeping items I want to share with you before we get started this evening. Tonight, we have included a feature to transcribe the audio of this presentation into a number of different languages. Shira will start the presentation with instructions on how to use this translation feature at the beginning of the presentation. All participant phone lines are going to be muted and cameras will be turned off to ensure that we have a clear connection throughout this session. We've set aside some time at the end of the presentation to answer any questions that you might have, and you can ask your question by selecting the Q&A button that you'll see at the top of your screen. And there's a little icon there, and a window will appear to submit your questions. There is an anonymous feature in this question and answer box if you would like to ask your question anonymously. Feel free to submit questions throughout the presentation as they come to you, and then we will go through the questions at the end of the session. Please note that we can only respond to general questions relating to today's presentation, and individualized advice cannot be provided. We will try to respond to as many questions as we can, and sometimes similar questions that we see will be grouped together and then answered together. You will see several polls throughout the evening. I think one just popped up for you as I'm doing the introduction, and then there will be some other polls throughout the session. As your feedback is really important to us, first of all, to understand the audience that we're having this evening, and then to understand your satisfaction with the session. If you're having any technical difficulties at all throughout the session, please use the Q&A feature to report them. We are very privileged to have IT support in the background throughout the session, and IT will be able to help you troubleshoot any IT or technical difficulties that you have. I'd like to welcome our presenters for this evening. First of all, we have Shira, who's completed her master's in social work at the University of Toronto and works as a mental health consultant at Kinark's Urgent Response Program. She has sat on the Peel Autism Collaborative in partnership with the Peel Regional Police, sharing insight and support and supporting with training emergency services responders. She supported the launch of the Family Navigation Project at Holland Bloorview Kids Rehab Hospital and has coached Special Olympic athletes. Shreya is a South Asian Canadian who is passionate about advocating for marginalized communities and people of color navigating healthcare in Canada. Aniga is the mother of 2 children and has her Master's of Business Administration, specializing in finance and economics. She has worked with many multinational corporations in finance management. She has excelled as an advocate for children, youth, and adults with multiple exceptionalities in the education, mental health, and autism sectors in her community. She is an active and respected Family Advisory Committee member at Carey's Place Autism Services, Lake Ridge Community Support Services, and Oshawa Accessibility Advisory Committee, Grandview Chilled Kids, and our very own Kinark Child and Family Services. Her participation has strengthened the partnership between staff and family members in working collaboratively by strengthening organizations by valuing, respecting, and incorporating families' voices. It is my absolute pleasure to hand over the presentation for this evening's event to these two dynamic presenters who will be sharing their wealth of information and knowledge on this very important topic. Thank you and enjoy.
All right, thank you so much, Joanne, for that amazing introduction. So let's get started. As she was mentioning, if you want to have subtitles while we are presenting, we have some images here where you can see from Microsoft Teams how you can turn on the live captions. So you'll see the More button at the top of your screen. So once you click that area, a little window will pop up and you'll have all these different options. The one that is highlighted says language and speech. If you click on that, it will show, it'll give you the option to click on show live captions. So just a reminder, you can go at the top where it says more, click and go to the language and speech where you have the option for show live captions. And then you can pick which language you want for the presentations. That way, in case, I recognize that English might not be everyone's first language. And, even for me, when I watch movies, I like having subtitles at the bottom in case I missed something. So it is helpful to have that at the bottom. If you have any difficulties with that, please let us know. So as mentioned, there will be two of us doing the presentation today. So I'm Shreya. I'm a mental health consultant that is at Kinark for the urgent response services at the Ontario Autism Program. And then we have a parent advocate, Annika, that will also be sharing a little bit of her journey and some valuable knowledge in terms of raising an individual with autism. So just to begin, we have some presentation guidelines. I recognize that some of this information is sensitive and it might be upsetting, so you can definitely take breaks as needed. Feel free to type your questions in the question and answer feature on Microsoft Teams. And the content that I'm sharing today, it's based on research. It's not a one size fits all approach. So I totally recognize some things that I might be sharing, it might not resonate with you, and that's totally okay. But it's just more so information that we've gathered that was available in Ontario and participants that were part of research in the province. So the agenda today, we already went through the welcome and introduction. I'm going to talk about the overview of barriers that newcomers face, culture shock and assimilating to a new environment, mental health challenges that immigrants often face, what the healthy immigrant effect means, and then I'm going to share some settlement community resources that I'd like to share with whoever has attended today as well, that will have some links towards some other services that you can access. At this time, I just wanted to mention that we do have another poll that is going to be popping up right now, that I just wanted to get some information about who's in the room today, and in terms of moving to Canada, if you're a newcomer or maybe you're a service provider or someone that moved a couple months ago, we'll get some information here. All right. So first, let's talk about the overview of barriers that newcomers face. Now, I totally recognize that I myself, I'm not a newcomer to Canada. I was born in Toronto. However, my parents immigrated to Canada from India in 1995. So I do recognize, there's a lot of hardships that they experienced as immigrants that definitely had an impact on my life as well as a first generation Canadian. From navigating the education system and learning about the different norms here, finding a job, and honestly just learning about the culture in Canada, it was definitely a lot for them. They were lucky enough to have family here and start a new life, but I recognize that not everybody is that not everyone is that lucky, and it can be very isolating and tough moving to a brand new country. So this topic about barriers for newcomers when navigating healthcare, it came to light when I was supporting with the launch of the Family Navigation Project during my placement as an MSW student. What I noticed that a lot of the families that were looking for support were new to Canada. They were overwhelmed when navigating services. And I met so many different mothers, fathers, families, and even some of the children that just moved to Canada because they wanted more support. And it was really hard. So many of them worked 2 jobs or they couldn't find a job. Some moved as refugees. They were struggling to get access to services because of their status in Canada. And some came to Canada just hearing that there was more supports there for their child. What I noticed was that this was a theme that was not widely discussed at the hospital. So I advocated this as a placement student that I wanted to talk about this topic because that's mainly the population that we're serving. And I wanted to normalize this experience, that it is a hard time. There is research that reflects what they're going through, and that there's actual definitions that explain their experience. So some of the challenges that immigrants face, I looked at the study that was conducted in Ontario, and they talked to parents that have children with disabilities and were newcomers to Canada. So one of them was language barriers. Not knowing English or maybe having very basic knowledge can be really hard when moving to a new country. It can feel overwhelming and honestly isolating as well, especially if you're trying to make friends or even just advocate for your child. Social isolation. It can be hard to meet new people, make new friends, and maybe you feel isolated to the ones that you knew back in your home country, and that can feel really hard. And another one is job challenges and education barriers. This one's really important because I feel like for many people, they might have worked a different job in their home country, but when they come to Canada, they're maybe told that you need to upgrade your degree, you might have to do some more courses, and that means it costs more money too. And typically when you move to a new country, financial hardship is something that does come with that, and you might not have that as a priority right now. Racial and ethnic discrimination, feeling like you're misunderstood from those around you. Maybe you're not living in a city that's very diverse, and those around you might not also understand your culture or also just have some stereotypes based on what they've heard in the media. Learning Canadian laws. This is definitely a big one because certain things that were maybe allowed in another country might not be the same in Canada, and that can be really overwhelming to have to learn right away. Communication patterns. In Canada, people speak a different way. Even if it is English, they might have different words and they might be talking about something else. For example, when we talk about a double, that refers to a coffee with 2 cream and 2 sugar. And that might be very confusing to someone if someone says, I want to grab a double today, it might not make sense. Even talking about a winter hat, which is a toque, and not many people in other countries use that language either. Even food, right? So navigating that as well, especially if you have dietary restrictions, if you're looking for food that is halal, or if you're vegetarian, that kind of food is very accessible in countries where those choices are widely available. Like in India, a lot of people are vegetarian. It's easy to find that. And that can be very frustrating trying to find food that you're used to, and you might not be able to find it. Cold weather. Now, a lot of people probably know that, yes, it is very cold in Canada. However, if you think about it, there's so much more to plan around it, even transportation, making sure that you leave extra early to turn your car on to get it warm, or even to plan for the bus route because it might be snowed in from the snow, or even just spending extra money to get a winter jacket or buy boots and all those types of things, learning how to shovel your driveway. All those things can be very stressful, especially for your first winter. And like I said earlier, socializing, it can be really rough trying to make new friends, especially when you're, have other priorities, finding services for your child, trying to manage finding a job. You might not really have time to make new friends and meet new people. So I looked at 3 studies that were conducted in Ontario, and one of them interviewed mothers who were immigrants to Canada and had children with a disability. So there was 3 themes that came up in this study that I think resonates with a lot of the people in our audience today, and something that I've definitely noticed in my work as well. So 3 of them are cultural stigma, too many services, and loss of social and emotional support. Now, cultural stigma means that disability is a taboo in some cultures, something that is not spoken about. For example, a stigma is very hush-hush. In some cultures, it might be mental health, it might be divorce. And since it creates a sense of shame, it can be harder to seek out services. And maybe because of experiences that they've had back home, they might still feel the same way here. Another theme that came up in the study that mothers reported was that there's way too many services. Families feel really overwhelmed having to follow up with different healthcare providers in addition to having language barriers. For example, there's social workers, speech language pathologists, ABA therapist, occupational therapist, and especially in some countries, you might only speak to a doctor or nurse. So that can be very overwhelming and stressful to have to keep up with everyone's roles. Next is loss of social and emotional support. So it can be hard to make friends in a new country, but you might also feel isolated from the ones back at home. You might feel pressure to tell them that things are going well and that you don't want your family back home to worry about you. So you don't really end up sharing any of the challenges that you're going through, and you're also having a hard time meeting people here, so you really can't talk to anyone. So these are some of the themes that came up, and let me go to the next slide. So this other study that was done at York University, they interviewed 30 mothers and 27 service providers in the GTA. And some more themes that came up was that there's excessive paperwork. There's too many things to fill out, and that can already just be such a big stress. There's very long wait times that can be discouraging. There's high costs for services. You might face racism and discrimination when accessing services. Lack of awareness of client needs by service providers. New school and education system that can be really rough. There's less social supports, and also parents who are wanting to preserve their culture, right? So parenting styles are very different, and sometimes service providers might give suggestions and recommendations that might not really align with what happens in your actual culture, right? So it can be really hard to align with service providers. And also for children, they're going to school, they're learning new norms, and they're bringing it home with their parents, but their parents aren't exposed to that environment, and they have to learn to be flexible, and that can be really hard. Now, a lot of these studies did talk about, interviews that they did with mothers, but, of course, dads and fathers are definitely as much involved as well. And what they found that was really interesting is that they called this a double burden, the stress that fathers experience. Now, fathers in some cultures are viewed as the decision maker or authority in the home, and their main role is to worry about finances and employment. And this can be really hard when they're experiencing financial stress, having a hard time finding a job, being a newcomer to Canada. And then they might not be able to always attend the meetings because they might be working 2 jobs or 3 jobs or working overnight. So what they found in this study was that a lot of dads have the fear of judgment from service providers that might continue to prevent them from attending services or even participating. So in the interviews that were conducted in these studies, there were some quotes here that I felt would be great to share with all of you today. So the first one says, yes, as an immigrant, you don't have close friends from childhood or the community. You feel isolated. You exaggerate the negative side and not the positive. With help of family members, it gives you a different perspective and it pulls you out. The next one, as an immigrant, I had no family. I had a few friends, but we moved a lot. However, I made a couple of friends in a parent group, and I'm still friends with them. One of the most important things is to speak to others in the same situation. Now, I found this quote very interesting and helpful because having that ability to speak to others that are going through the same experience as you, it can be very validating and can also normalize your experience. And that's why, we have Anaga today that is going to share some of her experiences and journey as a parent of a child with a disability. And I'm not going to say anything more. I'm going to let her take it away and we will go from there.
Hi, my name is Anagha Sumant, born and brought up in India. After marriage, my husband and I moved to US in 2008 and came back to India in 2014 after both my kids were born. Since birth, my son has been struggling with ongoing ear infections, developmental delays, speech and motor skill delays. But still, the pediatrician had no clue about autism and Fragile X syndrome. That was not even in the picture yet. I never heard these names before in my life. He thought my son might be a late talker who needs speech therapy and physiotherapy. But as a mom, I always had the gut feeling that there is more to the story, but no clue what it could be. We moved to Canada as an immigrant in 2016. My experience about life in Canada was very similar to the one in US, but entirely different from Indian culture, where I was born and grew up. The language, color, and race always mattered in each and every conversation with anybody that I met, as people's mentality and thoughts seemed to be awful and they won't mind it showing openly in the public, which would make me comprehend every moment that I was treated as an outsider or as an immigrant rather than treating us one of their own. I was made to realize that I needed a translation as my spoken English is hardly understood or I didn't understand the Canadian culture and don't deserve to be a part of it. So I always advocate for minorities as I don't want them to be emotionally and mentally tortured the way it had been for me. The humiliation which can never be forgotten. Cultural differences that impact autism, how it's identified and treated in India and Canada. Behaviors like avoiding eye contact can have different cultural interpretations. In India, avoiding eye contact is considered polite and respectful. Parents may recognize social symptoms earlier due to the value placed on social relatedness and conformity to social norms. However, they may delay seeking help due to cultural beliefs. In India, parents of children with autism may experience stigma, which can impact help seeking and health promoting behaviors. Also, there is a stigma attached to mental health issues in India, which discourages parents from seeking help for their child if they suspect they have autism. There is a worldwide lack of culturally appropriate screening and diagnostic tools for autism. Many people, including parents and teachers, are not even familiar with the signs and symptoms of autism, which delays the screening and diagnosis process. Although autism has a biological basis and there are clear criteria for a diagnosis, its symptoms may be viewed differently across different cultures. These differences may extend to the perception of autism in different cultures and perceptions of the most effective treatment options. Parents and caregivers may have different expectations for child development, which can now impact how they perceive the severity of the symptoms. Assessing social communication difficulties relies on deviations from culturally defined typical social communication. We moved to Canada as an immigrant in 2016. As we were residing in York region, the family doctor referred my son to the pediatrician in the area who let us know that in addition to my son's speech and developmental delays, she is suspecting something else but unsure what is it. Then further referred my son to a developmental pediatrician in Toronto, who immediately after seeing my son was confident that he has Fragile X syndrome, then sent us to Sick Kids for blood test and confirmed the diagnosis of full mutation Fragile X syndrome. The pediatrician referred my son to Grandview Kids in Durham region as we were planning to move there because she was having a doubt about something else was going on. After being on the wait list for a year, my son was diagnosed with autism, also eventually got additional diagnosis of ADHD, OCD, and anxiety in the next couple years. He was put on the OAP wait list in 2018 and after waiting for 4 more years, started receiving his funding. After getting new diagnosis of autism, We had to start applications for disability tax credit, SSAH, for additional funding, and from there my new journey started as I had to forget my existence and had to devote my entire life to my son for his betterment, looking and driving him to therapies. Finally, I became his personal secretary, managing where, when, how to navigate his life to its full potential. How I supported my life and my family the best way I could, either mentally or emotionally, or both. Surfing the internet, reading articles, enrolling in research, studies, joining social skill groups, workshops, respite groups, recreational activities, educating myself on how to support and socialize my son with autism, intellectual disability, ADHD, Fragile X syndrome, attending behavior management seminars and workshops to deal with his emerging transition struggles and behavior challenges to communicate better, learning how to work with the daycare to get extra support for him, working with the school team to get better support for him in the school, starting with getting an IPRC, IEP, EA support in school, and advocating to move him from the mainstream class to specialized classroom to get more support, looking for therapists online, visiting different agencies, checking and calling different providers to see if any occupational therapist, speech therapist was available, trying to work with the insurance to utilize psychological benefits for ABA therapy, joining support groups on Facebook, following agencies and school boards, signing up for emails and newsletters for any updates, working with doctors of different specialties to address various symptoms. I really appreciate that I got an opportunity to talk about my son and talk about the newcomer struggles which I have seen since I've been here. I'm really thankful to Shreya and Kinark Autism Services. Thank you very much.
That was amazing. Thank you so much, Annika. You know, your whole experience and journey is very valuable to everyone that is attending today, and just to learn from, you know, it's not easy, but you've definitely come a long way. And I thank you for also joining us today as well. So the next thing that I wanted to talk about was culture shock. So this is something that refers to the feelings of confusion, anxiety, and disorientation that people experience when they're exposed to a new or unfamiliar culture, environment, or way of life. It's common amongst immigrants, international students, and travelers as they adjust to new cultural norms, values, and practices. Now, I remember I experienced my first culture shock when I did a study abroad program in Italy. For the first few weeks, I was very excited. I loved everything. And then eventually, I got tired of having pizza and pasta every day, and I got a fever. And that was the first time I had to take care of myself when I was sick. I had to figure out going to a pharmacy in Italy, talking to others whose first language wasn't English. I didn't know Italian. I had to look for my own medicine. Just managing on my own, that's when I felt like, oh my gosh, like I just want to go home and this is way too intense for me. And it's not all unicorns and rainbows right now. And that's when I realized that, you know, I was feeling very disoriented and very overwhelmed. And I had a little bit of frustration and the culture shock. So there's four stages that culture shock occurs. First one is the honeymoon phase, where the culture might seem very fascinating, exciting. You're very optimistic about the new place. You're looking forward to things that were told to you that you would receive. And typically, in a lot of countries, Canada is regarded as a place of opportunity and success. For example, and I'm using India because that's where my family is from, in the media, in movies, amongst people, since so many people have moved to Canada, moved to Canada from India, there has been a lot of conversation about, you know, being very successful here, finding a great job, having your opportunities. And that expectation is there when you're also moving here as well. But obviously, there is the reality of navigating so much more than just starting a new life here. So the second phase is frustration, which is the culture shock, right? You're starting to feel homesickness. The social norms are overwhelming. You're struggling with the social cues. You're starting to miss familiar foods, routines, and customs. The next stage would be adjustment, when there's general adaptation, starting to understand and navigate cultural differences more effectively. Maybe you're starting to make new friends, you're finding some sort of comfort. The last stage would be feeling more at ease, right? So more sense of belonging and more time has passed now. So just hold on to this because I'm going to show the flip side of what this might not look like for others. Here is a graph in terms of the culture shock curve, right? So the honeymoon period, culture shock, adjustment, and then adaptation. So it shows the happiness of satisfaction in months in a foreign country. But this might not apply to parents of children with disabilities and being a newcomer to Canada, especially when you have specific goals in mind. Some might struggle to adjust and feel prolonged isolation, social withdrawal, lack of community, difficulty navigating jobs, and limited opportunities. And some might not ever adjust because of system barriers due to racism and discrimination, misunderstandings with locals, lack of support, or access to resources. Now, these examples that I just shared in terms of people that might not even go through the adjustment phase or adaptation phase is very similar to the worries and challenges that immigrants often experience when they first move to a country. So, when we talk about culture shock and this whole phase and the 4 stages, I definitely want to recognize that it might not seem like you're first off even coming into a honeymoon period, especially when you're coming here looking for services for your child and you're already very stressed out. But those are the 2 sides of the story that I wanted to share. So next, I wanted to share a little bit more about immigrants and mental health. Now, immigrants make up 23% of the Canadian population. So that's almost like 1 in 4 people. And in Toronto itself, immigrants make up 47% of the population. So that could be like literally 1 in 2 people. So some of the experiences that immigrants have shared and in terms of their mental health, how it gets impacted, they experience anxiety, depression, low self-esteem, worry, sadness, and caregiver burnout. And this was reported by Citizenship and Immigration Canada. The reason why anxiety might pop up, right, is because of uncertainties of employment or waiting for your immigrant status to get updated, adjusting to new norms, financial stress, and loss of familiar surroundings. There's also PTSD for refugees, especially if they're fleeing violence from their home country, and that might be something that they're still sitting with when they move to Canada. Now, I want to talk a little bit about determinants of mental health. So there's many things that can contribute to having a positive mental health and, like a healthy lifestyle. However, there's a bunch of different factors, but the ones that I want to talk about today would resonate more with the audience and population that we're talking to. So one of them is a social support network. So like we talked about earlier and Aniga was sharing, connecting with other people that have similar experiences, even just being able to hang out with somebody and, spend leisure time and, maybe go to the movies or just have some time to relax. A social support network is very important and it does contribute to your mental health. Next one that really stood out to me was a healthy child development. Now, this has kind of been the topic of our presentation today, right? That, as caregivers navigating healthcare, one of the main goals that we have is that we want our children to develop in a healthy environment and have access to services that they need. And this is definitely something that would contribute to one's mental health. Health services is definitely another determinant of mental health as well. Especially as caregivers, being able to access services for yourself to take care of yourself is very important. And navigating long wait times or even struggling to find a family doctor can be very disheartening. Employment and working conditions. Now, this is really important because for a lot of parents of children with disabilities, they might need to take time off work to attend their kids' appointments. They also might get phone calls from school where, they're being asked to come and pick up their child. And some managers and some workplaces might not be that flexible, and they might not be as understanding of your situation. What typically ends up happening is that you might need to, leave work, you might end up not working anymore, or it can create a lot of stress in the workplace, and that could be really rough, and of course, contribute to a poor mental health. Personal health practices and coping skills. Now, this one's really important, right? Everyone's own personal ways that they support themselves is something that we definitely need to consider. Caregivers often, devote themselves to their child and make sure that their child is okay. And then they might forget to take care of themselves, right? And I think something like that is very important because we want to prevent caregiver burnout. And we want to make sure that, all parents are taking care of themselves so that they have time to take care of their children too. So there's this concept in Canada that was called the healthy immigrant effect. So research reports that immigrants are healthier at the time of arrival in Canada more than Canadians, but within 2 years, it decreases. So what they found in this study was that when immigrants first arrive to Canada, they're usually younger, they're at working age, and typically healthier. And usually the immigration screening process selects individuals based on health criteria. However, over time, they might adopt unhealthy lifestyles, Canadian dietary habits, reduced physical activity, higher exposure to smoking or alcohol. And in addition to that, there's stress from settlement, moving to new country, unemployment, underemployment. So maybe you're working a role that might not be the same as what you were working in your home country, language barriers, and facing discrimination. Even healthcare access issues, like we earlier talked about, long wait times, the lack of culturally sensitive services, and a lower socioeconomic status that research has proven that is linked to poorer health outcomes. So talking about culturally sensitive services, there's an organization based in Scarborough called South Asian Autism Awareness Center, and they've been leading in terms of culturally sensitive services and actually, even sharing content where they speak with other families and clients to kind of share their experience while talking about culturally what is viewed when they talk about autism and disabilities. So they have this video up where they interviewed these parents that are originally from the Philippines. And they just kind of share their experience of what it looks like in Canada versus in Philippines. And I felt like it'd be very valuable to share today. So I'm just going to switch my screen share. So just bear with me for one moment. All right, so I'm going to play the video now, and I have shared my sound as well.
Also, I noticed that the sensitivity to the issue is really not that great. Um, you could easily hear a comment from a fellow from another Filipino about people with autism that are not so kind, and each time, you know, we're always like we're motivated to because we're advocates. We were motivated to explain to people what autism is really about to the best of our knowledge, based on our own experience and understanding. But we get to a point sometimes that it becomes exhausting to even explain the situation to a particular person just because of the lack of knowledge that they have. It becomes frustrating as well. Like, how come I've come to this point that I understood the situation? Is it because I have a relative with autism? Like, is it because I have a son with autism? how come the general public without experience, without first-hand experience with a person with autism cannot understand this? How come we haven't gone that far yet as to advocating, people with special needs?
Mhm.
Up until now, like, there are still friends who would make an unkind remark about people with special needs. Sometimes I would catch it because people don't know that I have a son with autism. Some people of my culture, and I'm talking about Filipino friends, I wouldn't openly talk about my son to them because I know that their understanding of autism isn't that broad yet. Isn't there? Not a lot of Filipinos are open-minded to what the needs of special needs people are. So I don't disclose it to a lot of people. You would see I post uh, articles or things about awareness about autism on Facebook, on my Facebook page, but you would never catch me saying it's about Lance, it's about my son, because I still have that fear that I would be talked about by these people, because these people, they don't under, they would rather uh, feast on what disabilities or disadvantages you have, rather than think of something to help you or think of something to support you. So the culture isn't that open yet, and it's still like what she said. It's on like still on that level of like, it's I wouldn't say it's taboo, but it's on
Being
almost on the same
open-minded.
level
Yeah.
as taboo, because it's something that people would um, not openly talk about, and I still feel guilty of that sometimes, because I could openly talk about this with people from other cultures here in Canada, but I couldn't even say it to my friend in the Philippines, just for the fear of being being talked about. I don't know, it would hurt me if they would comment, if would talk about me, if they would talk about this negatively more than positively. It hurts. It pains me to think that they would not understand my situation.
So, yeah, I really wanted to share this video just because I think it's really great to give individuals from the population a platform to share their experiences. And I think, SAC, they also, like, I'm pretty sure they have a podcast and they have interviewed other families as well. And they did a panel discussion with other individuals in the Asian community to kind of talk about, the intersection of navigating your own cultural norms, but also seeking services for individuals with autism. So I think it's definitely a great resource. So the next couple slides is me just sharing some resources that would be helpful. And I recognize it's so hard sometimes finding the right agency or service to kind of discuss what you need. So I compiled a list of a variety of them. So some of them are for, culturally sensitive programs that help you get services for, for your child with a disability. Some are also just settlement and refugee services, employment support, language training. So I just talked about SAC Autism Center. There's also Hong Fook that offers services in other languages like Cantonese and Mandarin. And then we also have Smile. They support racialized children and youth with disabilities and their families. They have caregiver programs that you can access, and other mental health programs as well, from the Punjabi Community Health Services, Caribbean, African, Canadian Social Services. So there's a variety here that we've included. My hope is that I'm going to share these resources with everyone that attended today. And all of the links are going to be clickable, so it's easy for you to get right to the website. And I put the numbers there so you don't have to search through a bunch of different pages. And then I think there's, yeah. And then I also have a list of other websites in terms of more information about the Ontario Autism Program, Easter Seals, which is another funding program that you can access, information from Holland Bloor Review and the Ontario Caregiver Helpline. So yeah, that's basically it for our presentation for now.
A copy of the session is going to be made available on our website in the coming days. So for those who've joined, please share with others that it'll be available on our website. And we're just going to be launching another poll to wrap up. Your feedback is really important to us. So please provide us your feedback to the questions, and the information that we gather really helps us drive to ensure that our presentations are meaningful, and to ensure that we understand how we can best meet the needs of our families and caregivers. So thank you all so much for attending this evening, and I hope you found it to be a meaningful session.